Hey guys, it's Leah B from Prestige Veteran Medical Consulting. I'm a U.S. Army veteran, physician assistant, and former compensation and pension examiner. So today I want to come on and discuss non-alcoholic fatty liver disease and how it can relate to obesity as an intermediate step in VA disability. So we've done a couple videos about non-alcoholic fatty liver disease and other liver conditions in the past, but this one I think is super important because I've had several questions recently about how this can relate to weight gain, like I said, as an intermediate step. So let's talk about what the disorder is in general first. So I have some information from the Mayo Clinic here pulled up, and they define non-alcoholic fatty liver disease, often called NAFLD. It's a liver problem that affects many people who drink little to no alcohol. So in this disorder, too much fat builds up in the liver, and it is seen most often in people who are overweight or obese. So it's becoming more common around the world, especially in Middle Eastern and Western nations, as the number of people with obesity rises. It is the most common form of chronic liver disease. That's pretty crazy, right? Affecting about 25% of the world's population. So this is a really prevalent disorder. It's really common. And a lot of people don't even know that it's something that they can have connected to their service. So in the United States, about 100 million people have the disorder. So some people can get non-alcoholic steatohepatitis, which is also called NASH. NASH is a serious form of fatty liver disease that causes the liver to swell and become damaged due to the fat deposits in the liver. NASH may get worse and may lead to serious liver scarring called cirrhosis and even liver cancer. This damage is like the damage caused by heavy alcohol use. So anyways, that's sort of the definition. Some of the symptoms that they describe here, basically it's you're sort of asymptomatic, but you can have fatigue, just generalized not feeling well, pain or discomfort in the upper right belly area. All right, so how can this be related to service? Well, if somebody gets diagnosed in service, it can be related on a direct basis. So you get diagnosed and it continues to be an issue that you have and you're on active duty, it can most likely be connected to your service. On a secondary basis, it can be caused by other issues. So we're going to talk about obesity as an intermediate step today. So let me pull up a little bit of the literature I have used in the past and share that with you guys so that you can take it to your treating doctors. Maybe they'll help you out and discuss it in a note for you. So, also disclaimer, I always throw this out there. I'm not an accredited legal professional. I'm not a VSO. I'm not an attorney. I am a medical professional. I used to be a CMP examiner. And so I really just stick to discussing the medical side of things. If you have questions about strategy or how to file a claim, you want to reach out to one of those types of professionals, you can get their information off of va.gov and search for someone in your area or anywhere in the United States. You can be represented anywhere, from my understanding, as long as they're accredited by the VA. So let's pull up some of this research that I use. So one of the first ones is the diagnosis and management of non-alcoholic fatty liver disease practice guidance from the American Association for the Study of Liver Disease, published in 2017. It established emerging conditions like sleep apnea, colorectal cancer, osteoporosis, and non-alcoholic fatty liver disease that can be associated with obesity. So obesity, type 2 diabetes, hypertension, dyslipidemia. Another study called Obesity and Non-Alcoholic Fatty Liver Disease, Biochemical, Metabolic, and Clinical Implications, published in 2010 in Hepatology, discussed that obesity is associated with an increased risk of non-alcoholic fatty liver disease and how obesity contributes to the disorder. Just general stuff. Lack of exercise is a major cause of chronic disease. This is a study published in Comprehensive Physiology, discusses how lack of exercise in general, whether it's related to an orthopedic condition you might have, maybe you're a double amputee and you can't get out there and do a lot of physical activities. Maybe you've got a mental health condition and you avoid the gym, right? You have social phobia. You don't like to go out of the house, things like that. We've talked about this a lot in some obesity videos in the past. So another article, Obesity, Abdominal Obesity, Physical Activity, and Caloric Intake in U.S. Adults, 1998 to 2010, published in the American Journal of Medicine, examined trends in obesity, And the study found conclusively that BMI and waist circumference trends were associated with physical activity level, but not caloric intake. So this article is basically saying, and a lot of the ones that I'll discuss here in the next few minutes, that diet works in the short term, but exercise is something that lifelong can help you maintain a healthy weight. So 3-year follow-up of participants in a commercial weight loss program. Can you keep it off? Published in the Archives of Internal Medicine. Assessed maintenance of weight loss achieved during dieting. The study noted that mean weight of the participants was only modestly less than the group's original weight at the start of the diet. The follow-up found that 12% of the subjects maintained 75% of the weight loss after leaving the diet program. 57% maintained at least 5% of the loss, and 40% gained back more than they had lost during the diet. Another article, reducing calorie intake may not help you lose body weight. Another that was published in Perspectives of Psychological Science in 2017. Exercise and fitness effects on obesity, published in Stat Pearls, is a good one. It said that a minimum of 150 to 300 minutes of moderate physical activity per week, or 75 to 150 minutes of vigorous physical activity weekly, is essential to prevent weight regain. I'll give you guys one more here. So weight loss interventions and non-alcoholic fatty liver disease, optimizing liver outcomes, published in Diabetes, Obesity, and Metabolism, shows that weight loss is the most effective treatment for non-alcoholic fatty liver disease and is recommended in all national and international guidelines. All right. So let me jump over to the ratings. So ratings are always subject to change, but I'm going to go over what they are currently, so you guys just, have some kind of an idea. So it's important that the 3 sort of tenets for any condition is that you can show that you have a current diagnosed disability, that there was an in-service event, injury, or illness that caused the disability, and that there's a link between whatever that incident is and your current disability. Okay, so it can be rated at 100% if you have near constant, completely disabling symptoms like fatigue, uneasiness, vomiting, anorexia, joint pain, and pain in the upper right abdomen. It can be 60% for significant fatigue or uneasiness or anorexia with significant weight loss, or incapacitating episodes totaling 6 weeks or more in the past year that include symptoms of fatigue, uneasiness, nausea, vomiting, anorexia. And then it goes down to 40%. And that is very similar. You've got to have weight loss and swelling in the liver, or if there are incapacitating episodes totaling 4 to 6 weeks in the past year that include symptoms like fatigue, uneasiness, nausea, vomiting. 20% level is pretty much the same as the above, but with 2 to 4 weeks in the past year of incapacitating episodes, and then 10% below that. So I hope this was helpful, and I hope you guys enjoyed this video. I've got another one on non-alcoholic fatty liver disease that you guys might want to check out. Please drop some comments and let me know if you guys have any feedback, and best of luck to y'all with this. Thanks for watching. Please like and subscribe.